Come on in. Hey, welcome.
Hi, good to see you.
Great to see you.
Are you excited to get started with our interview?
Absolutely.
What treatment did you just administer?
We just did some Botox.
Oh, we've all heard of Botox. What does it actually do?
So Botox has a lot of uses, but in this particular case, we were softening some of the upper facial wrinkles.
Oh, great. All right, let's get to know you a little bit better.
Sure.
Where's your favorite place to vacation to?
I mean, Italy, of course. There's so many great places there.
Where would you like to travel that you've never been to before?
Antarctica, I find it's really cool. I'd love to go there.
What's your go-to coffee order?
Espresso macchiato.
What's your favorite color?
Blue, all shades of it, but especially sky blue.
Do you play any sports?
Cycling, does that count?
Yeah. What are 3 things you can't live without?
So my friends and family, nature, and my MacBook Pro.
What motivates you?
Being the best I can be and constantly learning.
Amazing. Who inspires you?
Authentic, driven, and open-minded individuals.
What is something that you would tell your younger self?
I'd say that the sky is not the limit, you are.
Awesome.
Well, why don't we get going a little bit around the office? Why don't I show you the reception area?
Perfect, let's go.
So come on with me and we're gonna go down this hallway. This is on our way out. On the left is our checkout area. And we're just gonna go over here. You're gonna follow me. On the right is our waiting room. And this is our reception area right over here, just where I'm standing.
Well, you've seen many patients over the year. What is the most common concern that you treat?
I'd say probably the disconnect between the young, vibrant energy people feel inside and what they see on the outside.
And how would you address that concern?
Well, that's where the magic happens. That's where we do our 360-degree comprehensive assessment and then come up with a customized treatment plan that's tailored to every individual.
And what is the first thing that you notice about someone when you meet them?
I'd say it's their energy and the vibe they give off.
If you were not a dermatologist, what would you be doing?
So many different things, but maybe an architect or a designer, maybe even a marketer.
When did you found Bertucci MedSpa?
In the year 2000.
Why did you choose the field you're in?
I feel like when I first started my professional career, cosmetic dermatology was really in its infancy. And I love the fact that I'm able to combine science and art, and I was able to make a difference in the development of this field, and at the same time make people happy.
Awesome. What education and training did you do to get to where you are today?
So after high school, I did 13 years of training. I did 2 years of undergraduate science, 4 years of medical school, 3 years of dermatology training, before that 3 years of internal medicine training, and then finally a year of subspecialty in surgical cosmetic dermatology.
Oh wow, that's a lot.
Yeah, it's a long time.
What is your favorite snack?
Gelato, to be specific, nocciola or hazelnut flavor.
What is your favorite cocktail?
Espresso martini, it's a theme.
What is your comfort movie?
There's a lot of them, but I love Love Actually.
Do you like surprises?
I like fun surprises. Okay, why don't we move from this room, the reception, why don't we go over to one of the product rooms, one of the treatment rooms, and I'll show you what it's like in there.
Perfect.
Follow me down this way down here, and we're gonna make a left, and I'm gonna show you down this long hallway, and at the end, we're gonna make a left turn, and this is gonna be what we call the product room. It's one of the treatment rooms, and in here, we do some of the skin assessments. For example, if you look here on my left, we use the skin scope. It's one of the things that we look to assess color, sunspots, and so on. And we have some skincare products.
Great. So what is your favorite treatment to administer?
I'd say fillers. It allows me to be very creative and combine the science and art of medicine, or cosmetic dermatology specifically, to achieve natural results.
And what do you think is the most challenging thing about your job?
I think expectation management is probably the thing.
And can you elaborate a bit on that?
Yeah, I'd say it's basically making sure that what we deliver aligns with patient expectations.
What do you think is the most rewarding part about your job?
I love handing patients the mirror after we complete a treatment and watching their reaction. It's just priceless.
What is a must-have skincare product for you?
That's a good one. One of my faves is the Elta MD sunscreen. Can't do without it.
What is a song that you could listen to on repeat?
Oh my God, I'm so into music and that's a really difficult one, but maybe Whitney by Rev. It's such a good beat.
Can you sing it for us?
Oh, you do not want to hear me sing.
What is your favorite season?
I like many, but I'd say summer overall.
What's your favorite way to spend the weekend?
Oh, so maybe doing a fun, active outdoor activity such as cycling, then maybe stopping somewhere on a patio and having a nice meal, perhaps after going for a walk, and throwing in some gelato in there.
Who do you look up to?
I'd say authentic individuals who are striving to live their best life.
Are you a morning or a night person?
Both.
Are you an introvert or an extrovert?
I think I'm an extroverted introvert.
What's one word to describe a typical workday?
I'm going to choose two words, fun and fulfilling. They both begin with the same letter.
And final question, who is your first celebrity crush?
Ooh, Julia Roberts.
Awesome. Thanks for taking the time to chat with us. It was great getting to know you better.
Thank you so much.
Bye.
Bye.